Hi, my name is Julia LaValle, and I did my presentation on cocaine use during pregnancy. So, epidemiological factors. I had trouble finding a lot of the epidemiological information on cocaine use during pregnancy, both statewide and nationally. However, in 2022 to 2023, there were 23 per 100,000 residents with stimulated related deaths and 15.7 per 100,000 residents of stimulated related ER visits in Massachusetts. And then again, nationally, I didn't have a lot of current data, a lot of older data from the 90s and early 2000s. However, I found that nationally there are about 750,000 cocaine exposed pregnancies per year, most likely due to the high rate of unplanned pregnancies. And then 1.1% of young adults, which is ages 18 to 25, use cocaine. So the maternal risks of cocaine use during pregnancy include migraine, seizures, preeclampsia, high blood pressure, and organ damage. The perinatal risks of cocaine use during pregnancy are preterm birth, premature rupture of membranes, placental abruption, placental infarction, intrauterine growth restriction, low birth weight, and small for gestational age infant. And the fetal risks associated with cocaine use during pregnancy. Some studies have shown slower growth rates, poor adolescent functioning, poor perceptual reasoning, impairment in procedural learning, behavioral problems, symptoms of ODD and ADHD, poor language development. However, the socio-demographic and environmental factors should be considered with these findings. So there's no screening tool that is specific to solely cocaine use during pregnancy or cocaine use at all. However, the World Health Organization recommends different screening tools used mostly for just illicit drug use at all. But those include the proprietary 4Ps Plus, the National Institute on Drug Abuse Quick Screen, the Modified Alcohol Smoking and Substance Involved Screening Test. So the 4Ps is a questionnaire regarding substance abuse of the patient, partner, peers, and parents. The NIDA Quick Screen has a high sensitivity and specificity. It includes illicit and prescription drugs, and it's not intended for a pregnant population, but studies show that it still works amongst this population. And the ASSIST questionnaire pertains to alcohol, smoking, and drug use. It's available in multiple languages, and it was developed for international use, but it is not specific to just pregnancy. So the presentation of the patient. The subjective presentation of mom who uses cocaine, that would look like altered mental status, chest pain, headache, diaphoretic, agitation, pruritus, blurred vision, diarrhea, nausea, vomiting, excited delirium, or manic-like symptoms. A infant at birth born to a mother who uses cocaine would show irritability, hyperactivity, tremors, a high-pitched cry, and excessive sucking. The objective presentation of mom who uses cocaine would be hypertension, tachycardic, hypothermic, and the pupils would be constricted. An infant at birth of a mom who uses cocaine would have a low birth weight, a small head circumference, and would be shorter in length. So the differential diagnoses for cocaine use during pregnancy would be hypoglycemia, anticholinergic toxicity, acute schizophrenia, delirium tremens, and a CNS hemorrhage. So the prenatal care by trimester. The first trimester, the physiologic factors would be evaluating the symptoms relating to cocaine use and overall health of patients. So really honing into those symptoms that are related to cocaine use and just how the patient is doing overall in the first trimester. The psychological factors would be evaluating the patient's mental status and identifying any issues and medications that they may take. Psychosocial factors would be evaluating their social environment, who they spend their time around, where this drug use might be sourced from, and refer patient to addiction services if they do need it. The legal factors would be evaluating past legal concerns with or without cocaine involvement. The second trimester, again, the physiologic factors would be looking at the size of the fetus, evaluating the health of the fetus and the mother, and then assessing the mother's symptoms. So any symptoms related to cocaine use, just the general health status during the pregnancy of the mother, but then looking at the fetus and seeing if they're experiencing any symptoms or if they're growth-related issues. And the psychological factors would be to refer the patient to addiction services and evaluating the mental status. The psychosocial factors would be looking at their social environment and their mental health status. So again, looking who they're spending their time with, if they are still using throughout their pregnancy. Legal factors, looking if DCF may have to become involved if it's kind of chronic drug use and there's going to be issues at the home. In the third trimester, again, looking at the size of the fetus, evaluating the health status of the fetus and the mother, and just looking to see if the fetus is growing appropriately for the third trimester. The psychological factors would be, again, referring the patient to addiction services if they need it and looking at their mental health status, and psychosocial factors, so looking at the social environment and their mental health status, and then legal factors, determining if DCF must interfere or if any legal action must take place, especially after the baby is born.